Over the past 2 decades, life expectancy in rural areas has declined. One reason is the prevalence of diabetes. With support from the Pulitzer Center and in collaboration with the Global Health Reporting Center, special correspondent Dr. Alok Patel reports from the Rio Grande Valley in Texas. It's part of our ongoing series, Rural RX.
Okay, yeah, go ahead.
It's dinner time in Edinburgh, Texas. Zaira Guajardo, age 11, is helping to lay out the plates.
She's drinking lemonade, but the lemonade, it is sugar-free.
They're watching the sugar because Zaira has diabetes, diagnosed last fall.
At first, she had gotten strep throat. Then she had gotten scarlet fever. And she just kept picking up every single virus. I just told my doctor, I can't do this anymore. You need to find out what's wrong with my daughter.
I was getting sick, super sick. They had ice packs all over me.
She ended up in the hospital.
It's about the 3rd day they came back. They did a history in her blood and found that 3 months before that, her body had stopped producing insulin. What did you have? And now looking back and thinking all the signs, where she was always thirsty, she peed a lot so much, she'd get up so much in the middle of the night, and I'm like, you need your full night's rest. And I would have never thought that this could happen to her.
Morning, Sierra. This one is the testing strip to test what my blood is. I'm scared that it's gonna go too high or too low. 128.
11%, or 37 million Americans, have diabetes. And it's an even bigger problem for rural areas. In places like South Texas, the percentage of people with diabetes ranges from 15 to 21%. Dr. Yvonne Melendez is a family medicine specialist and the top public health official in Hidalgo County.
Can you give me an example of some of the big public health needs in this community that you look after?
Oh my God, the examples are too numerous to count. You imagine, if you will, if you lived in a county where you were one or two always as the most poverty-stricken counties in the entire country. So we are the most obese, the most diabetic, the most hypertensive, the poorest, and an average education level of 8th grade.
Of diabetes patients, about 6%, including Zaira, have type 1, an autoimmune disorder. The vast majority have type 2 diabetes, which is closely linked to diet and lack of activity, which Zaira's doctor says are both common here.
Well, remember that type 2 diabetes goes hand by hand with the incidence of obesity.
Across the country, rural children are 26% more likely to be obese.
And you can add to that the fact that here in the South Texas, there is not too much exercise, either for the weather, because the distance is too long and we are used to walk like the people in New York, for example.
Hispanic Americans are especially vulnerable, far more likely to have type 2 diabetes compared to non-Hispanic whites.
So we have all the factors: obesity, a very poor diet, financial reasons, and cultural reasons. Here, if you're not at least 20% overweight, you're considered skinny. We have a high carbohydrate, we have 70 to 80% carbohydrate diets, and then the access of quality food. And so it's if you will, I hate to use this cliche, but it's a perfect storm.
Sylvia Garcia is a nurse making home visits for a program run by UT Health Houston.
Buenos días. Buenos días. Ay, ¿cómo está? Los mayores problemas.
The biggest problem sometimes is poverty because they don't have the money to buy their medicines.
Before Gloria Cortez was connected with this program, just getting to the doctor was an ordeal.
To go to the doctor, it took about an hour. Sometimes all day.
This is a part of the country that if you do not have a vehicle, then it's extremely difficult for you to get about. The public bus system is murderous. It's just non-existent.
Diabetes requires constant management.
How do you get to the pharmacy? How do you get to your doctor? How do you get to follow-up?
Visiting nurses are one solution. Another comes from UT Rio Grande Valley, which sends a mobile unit to locations around the region.
Once a person has it under control, we need to think about the long term.
We try to make it to areas that are a little bit further out, a little bit more rural clinics, rural areas.
But transportation isn't the only challenge.
I think that we're deeper in poverty here than in many places.
Linda Nelson is Senior Director of Clinical Operations for UT Health Rio Grande Valley. She oversees the mobile unit, as well as a network of 30 clinics.
If we don't have a low-cost health system for them, they don't come. A lot of our patients are day laborers. If they don't go to work, they don't get paid.
So do you commonly run into patients who are having to pick between sustaining life with their family or work versus their own health?
Sure, every day.
Census data says a third of area residents are uninsured. However, a research project at UT Houston found the true proportion is even higher.
Here in the Rio Grande, more than 50% of the community does not have access to health insurance. 50% is a very high number.
Immigration status can be another barrier to care. Many medical providers here don't even ask, so they don't scare patients away.
There were people who didn't go to the clinic to pick up their medication because they were afraid of being detained. We struggle a lot to get people to go to their appointments, to get people to go pick up their medications.
For some families with children, it's a complicated dance, says Deborah Franco, who runs the South Texas Juvenile Diabetes Association.
The children may not be undocumented. They may be born here in the United States, but the parents are undocumented. And so that creates this crazy, distrust of the system.
Undocumented or not, treating chronic illness puts a premium on lifestyle changes.
Healthy vegetables are also a bit more expensive. The places are far away.
Despite being surrounded by farmland, for people here, fresh fruit and vegetables are hard to come by.
So we started a specialized food pantry, and we have a community garden so that we can also educate our families on how to have a healthier lifestyle.
Prevention is the key.
Yvonne Melendez says that for most people, it also takes a big change in mindset.
And how do you convince a 42-year-old man with a family of 3, all 5 of them, who make $500 a week, to go get their diabetes check or get their obesity check? How do you feed someone who has eggs and beans and bacon in the morning and a fajita platter at lunch and a hamburger in the evening? It's a lifestyle. So it's a tremendous hurdle.
Diet may not cause type 1 diabetes, but certain foods can lead to a dangerous spike in blood sugar.
So when you look around the cafeteria and you see Takis and candy, what do you think?
Trouble, 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 and trouble.
You literally look around and in your mind you think,
sugar up.
Do your friends know what you're going through?
Yes. They're like, we support you, we love you.
Nearly half the patients with Zaira's form of diabetes go on to develop serious complications. But by catching and treating it early, she has a much better chance of beating the odds. For the PBS NewsHour, I'm Dr. Alok Patel in Edinburgh, Texas.